Thanks for joining us. I'm Tim Schatz with Minnesota Health Insurance Network, and today I'll be talking about the presentation that we gave for the Medicare Made Easy, sponsored by Education Minnesota, the ESI member benefits. So today what I'll talk about is a little bit about Education Minnesota and our relationship, being Minnesota Health Insurance Network, with Education Minnesota. Then I'll talk about the fundamentals of Medicare. We'll talk more about Part A, B, C, D of Medicare, and then also some types of plans that we feel it's important that you're aware of when purchasing health insurance in the Minnesota marketplace. First, I'll start out with a little background about our company, Minnesota Health Insurance Network. And before I do that, I feel it's important that you know, as an Education Minnesota member, how our relationship started. About 5 or 6 years ago, Education Minnesota was looking for a solution for its retired members to find ways to shop for affordable health insurance. Education Minnesota had a very strict guidelines. They didn't want to just choose any old agency. They wanted to find an agency that was able to represent all of the carriers in the marketplace. So what we've done for Education Minnesota members since then is we've been able to help them fully understand what benefits are available to them, and also compare and contrast their current plans to make sure that they're getting the best needs. On top of that, what we've done as Minnesota Health Insurance Network is we've created these specialized group health insurance plans that are only available to Education Minnesota members and their spouses. In order to access membership to these plans, you do have to be a retired Education Minnesota member. So that's how our partnership began. Now a little bit more about our company is we are an independent agency with over 20 years of experience within the health insurance related industry. We also represent all of the major health providers in Minnesota, and it's our job to help you better understand what your options are. We can do this by helping you compare and contrast drug formularies, different carriers, and compare and contrast these group offerings that we'll talk about today to your current situation, what you may have through the district or what you may have in the individual marketplace. Another thing that I feel is important to mention about our agency is, again, those exclusive group Medicare benefits that we'll be talking about today. And there's actually 3 more presentations that will be attached to this website, and you'll be able to key in on the differences between the different offerings from the carriers. Group-sponsored plans are actually offered through Humana, UCare, and Medica. So those are the 3 group-sponsored carriers. And again, if you're interested in more information about their specific plan, I encourage you to click on the video for each of their presentations. Today, once again, I'm highlighting the Humana, Medica, and UCare plans, although we do, as an independent agency, still work with those other carriers, Health Partners or Blue Cross. We just do not have any specialized group plans that are available at this time through Education Minnesota. But if you are on one of those plans currently or have questions about any of those plans, I would be happy to assist you and help you compare and contrast those plans to the group-sponsored plans offered through Education Minnesota. So let's talk about Medicare. Now, what is Medicare? I think it's important to know what Medicare actually is. And as most of us are aware, it's a government program developed for the nation's aged to provide you financial benefits for some health-related occurrences. So what does Medicare cover? Well, it covers some basic hospital stays, physician visits, and very limited prescription drugs. Now, it's important to note that these are not prescription drugs that are offered through your pharmacy. That would fall under a private plan that you'd have to purchase. These are prescription drugs that are usually administered by a doctor in the doctor's office. Okay, so there are some limitations which we'll go over as well. So it's also important to know, how do you qualify for Medicare? Well, there's 3 main ways to qualify for Medicare. The first, and many say the easiest, is just to turn the age 65. Once you turn 65, you'd be eligible for Medicare. The second way is if you became permanently disabled. So those that become permanently disabled before the age of 65 and collect on Social Security for 24 months or longer, then would be entitled to Medicare. And then also those that are not yet 65 but become diagnosed with end-stage renal disease, they would also become eligible for Medicare regardless of age. So how is Medicare divided? Well, Medicare, this is when these letters come into play, the Part A, B, C, and D. So let's start with the first. Part A is going to be your inpatient hospital services. If you had Part A for inpatient hospital services, you would have a benefit deductible. Okay, and that deductible you would pay before the actual insurance turned on. That deductible would reset every January, and you'd have to continue to pay that deductible if you were inpatient in the hospital. When you work with a private company, the private company helps usually fill in that deductible or replace that deductible. So for most members that are currently on Medicare that work with a private company, you may not have to experience this inpatient hospital deductible. This is just if you had original Medicare, only Part A. Then there's the Part B. And Part B is a little bit more common because this is what people use a little bit more often than being inpatient in the hospital. This is where your outpatient services come in, to see a primary care doctor or a specialist. Those are all outpatient-based services. So with Part B, there is a monthly premium that you'd have to pay each month, and then this is also more known as the co-insurance plan. So Part B actually does also have a deductible, but the deductible is a little bit lower than Part A. It's only around $147 for 2015. But this is where when people think of Medicare, they think of co-insurance. Part B is the co-insurance plan. So Medicare would cover 80% of your Part B costs. You would pay 20%. Now, having both Parts A and B together are what we call original Medicare. Now, it's important to know that before you buy any other insurance through the private market, you always must have Part A and Part B in order to participate in a different insurance plan. Now we have Part C. Now what Part C is it's truly called a Medicare Advantage plan. This is one of the types of plans you have available to you in the marketplace. You do not need to choose a specific Part C plan if you don't want to. This is truly just an option that you have that you would purchase through a private company. Next is Part D. Part D is easy to remember because it stands for drugs. Part D is our prescription drug program. This Part D is also through a private company, so there is an additional premium associated with that. Now Part D is overseen by Medicare, and Medicare sets the rules for the Part D providers. However, there's an additional premium because you're buying that actually through a private company. It's not purchased through Medicare itself. So how do you pay for Medicare? What are the costs? Well, Part A does have no cost, and the reason why they don't for most people is because most people have been paying for that out of their Social Security. Out of their payroll taxes. So when you were working, as long as you worked for 40 quarters or more, which is 10 years or more, you were paying for Social Security and Medicare through payroll taxes. The cost for the Medicare was actually going towards covering your Part A. So now, at this time, there's no additional cost for your Part A services. There is, however, a cost for your Part B services. The standard cost in 2015 is $104.90. Now, this premium can actually increase. It's based on your income, and how Medicare works, they look 2 years back. So if you're starting new to Medicare in 2015, they would look back to your 2013 tax return. If you made over $85,000 and you file as a single person, or if you made over $170,000 filing as a family, you would pay above and beyond that $104.90. So it's based on your income. So it could cost more than that. New to 2016, members that are going to be new in 2016 will have an increased Part B premium, and that increase is projected to be $121.80. At this time, we don't have final word on that. However, the most up-to-date information shows that it's leaning towards $121.80 starting in 2016. Is there a cost for Part C? Yes, there is an additional premium. Remember, this is optional. You do not have to pick up Part C. It's one of the plans that you have as a choice. If you do, there is an additional premium, but it's based on the plan that you actually choose. On Part D, there is also an optional premium. Once again, It's through a private carrier, so Part D premium would be additional based on whatever Part D plan you decide to purchase. So when can we enroll into Medicare? Well, for most of us that are just turning 65, we have this thing called this initial coverage election period. So really what that is it's a 7-month window you have to actually enroll into Medicare. You're going to have 3 months before your birth date, the month of your birth date, and 3 months after your birth date in order to enroll into Medicare. Now, if you were born on the 1st of the month, your Medicare start date would actually be a month before your birthday month. So for those of you that were born on the 1st of the month, your enrollment into Medicare actually does not start the same month of your birth date. It actually starts the month before. But once again, to enroll into Medicare, you would have 3 months before that date, the month of, and 3 months after. Now, enrollment is done through the Social Security Administration. That's where you would enroll into Medicare. Now, you can do that by going to the Social Security website, or you can go into your local Social Security office. Now, even though you have this 7-month window, if you are planning on starting Medicare when you do turn 65, the month you turn 65, or those of you that are born on the 1st, if you want to start Medicare the month before you turn 65, I highly encourage that you start the process, the Medicare enrollment process, 2 to 3 months before you want the coverage to start. And the reason being is because if you wait until your birthday month or a couple months after, Medicare will drag its feet and they will not give you the effective date that you may be asking for. So if you want Medicare to start your birthday month, or again if you're born on the 1st and want to start the month before your birthday month, when you turn 65, you want to start 2 to 3 months before your 65th birthday with enrolling into Medicare. Those of you that are drawing from Social Security before you turn 65, once you do turn 65, they will automatically enroll you into Medicare. So there's nothing more that you need to do. Medicare will automatically enroll you because you're drawing from Social Security. Okay, but if you're not, and you want that, again, I highly encourage that you enroll on the front end of that 7-month window. Those of you that are currently on Medicare, every year you have the opportunity to make changes to your Medicare drug plan that you may have, or to your insurance plan that you may have that works with Medicare. You can do that during the annual election period. And that time happens from October 15th through December 7th. I always tell my clients it's important to remember that's the time to make changes. One good way to remember that is if you're sitting down at your Thanksgiving table and you're eating your turkey, you want to think, are you thankful for the plan you have, or are you not? If you're not thankful for the plan that you have, that's the time to make changes to your insurance. And then some of us may work past the age of 65, and that's okay. You are not required to start Medicare when you turn 65. You can absolutely work past the age of 65 or be on a spouse's employer's plan as long as it meets the credible coverage without having to pick up your Part B or Part A of Medicare. So you can basically suspend that and not enroll into Medicare until a later time without being penalized. Then you'd fall under a special election period. So you'd have actually 2 months before you need the coverage and the month of and 2 months after in order to get into Medicare. Again, if you are planning on working and you're covered through your employer's plan, there's a couple things you need to be aware of. Number one is we want to make sure that your coverage is considered credible. Okay? And what that means is it's as good or better than what Medicare could offer you through the prescription drug side. Okay? That's a very important piece, because if it's not and you try to get into Medicare later on, they may have a waiting period or they may charge you a penalty for not having credible coverage. So you really want to focus on that. A key thing to note here is that if you are working past age of 65, again, that's fine, but confirm with your employer that it's credible coverage. COBRA insurance or continuation of a group plan, if you're retired, is not considered credible insurance. So for those of you that have in your contract through the district that you're given free health insurance for 6 months, Medicare looks at your retirement date. if you retire in June, and even though you have health insurance through the end of December, you still need to enroll into Medicare, your Part B, when you're first eligible. Otherwise, you could be locked out and potentially face a penalty. If you have any questions, feel free to use the website. www.medicare.gov is a wonderful website. Otherwise, you can feel free to call me personally, and I'd be happy to help you through if you're working past age of 65 or staying on a spouse's plan past the age of 65. So, one important thing to note with these Education Minnesota sponsored group plans is that you can actually enroll into these plans at any time. So it's very unique with this Education Minnesota sponsored plan. And the reason we've done this is because Education Minnesota wanted you to have the ability to choose this plan every year. So you can make the determination, is this a good plan for me this year? If it is, you can take advantage of any of these plans that we're going to talk about. If it's not, you don't have to worry about applying to that plan. You can stay in your current plan or choose a different one. But the neat thing is that Education Minnesota wanted to leave this open to you to make the decision to determine what's best for you for that year. So now let's talk about the different types of Medicare plans to choose from. In my eyes, I always lump these into 3 different types of plans. So when we're talking about medical types of plans, these are insurance policies that either work with original Medicare, your Part A and B, or they all replace original Medicare, in which case you would run everything through the private company. So there's really 3 different types of plans in the marketplace, and they are Medicare supplement plans, cost plans, and Medicare Advantage plans. We're going to start talking about the Medicare supplement plans. And I'm just going to touch base on this because the carriers that we have offered through the Education Minnesota group sponsored plans, none of the carriers are technically Medicare supplement plans. The carriers are actually cost plans or Medicare Advantage plans. So we'll focus more on those, and within the carriers' videos that you can also click on, you'll get a better understanding of what that means for those. But I want to give you just a brief overview of what a Medicare supplement plan is. So if you're on a true Medicare supplement plan, what happens is that you retain your parts of Part A and B of original Medicare. All that means to you is that Medicare is the primary payer. When you go in for services, you usually have to stay within a network in the state that you live in. But when you're outside the state, all you need to ask is, do you accept Medicare patients? If they accept Medicare patients, that is truly going to be your network. So as long as that provider will bill Medicare, Medicare will pay first, and your private company will fill in the gaps. And that's truly how a Medicare supplement works. Now, in these plans, you can usually see any provider in the United States that accepts Medicare. Again, some carriers do have some restrictions about when you're inside their service area, which is usually their home state, that you have to stay within the network. But again, traveling outside of there, you can see any provider as long as it accepts Medicare patients. These plans are the only plans that you are guaranteed you can take with you if you move. And you can take the exact same plan design, you just get it registered in a different state. You would even be able to pay Minnesota rates if you bought a plan in Minnesota and decide to move to someplace warm, such as Florida or Arizona. So again, these are the only plans you can actually take with you if you move. And the third thing to mention is that these plans do not include a prescription drug coverage. Now, you absolutely have the opportunity to choose your own standalone prescription drug coverage. So you still have the opportunity to buy drug coverage, but they do not automatically include the drug piece into the plan itself. So that's a Medicare supplement plan. The next type of plan, as I mentioned, are called cost plans. Now, cost plans are unique because for your Part A services, Medicare itself is the primary payer. And for the Part B services, the primary payer is your private insurance company. So the difference between this and the Medicare supplements is that sometimes Medicare pays first, and sometimes your private company pays first. What does that mean to you? Well, it shouldn't mean that much. Really what it means is that if you're inside the state or the service area, you always want to stay within the network. And inside that state, you carry around the carrier-specific card that you choose to work with. You run all of your bills through that carrier's card on the medical side. If you're traveling outside of the network or the state, then you want to carry around your Medicare card. And when you're traveling outside, you can see any provider as long as they accept Medicare patients. So it offers you very similar travel flexibility as the Medicare supplements, but the difference is that it's under a travel piece, meaning you cannot take these plans with you. You have to maintain your Minnesota residency. Okay? So you can't take the plans with you if you move, but if you're traveling, you can absolutely take advantage of the travel benefits, which again would just require that you see a Medicare provider, so a provider that will bill Medicare. And you'll be treated just as if you're at home in network, so you pay the same co-pays as if you're at home in your network. So again, these benefits are always best when you stay within the network when you're in the service area. But also, as we just mentioned, when you're outside, you can see any provider that accepts Medicare. It just happens to fall underneath the carrier's travel benefit. So most carriers have a travel benefit of either up to 6 or 9 months of the year. So for the snowbirds that are gone for 3 or 4 months at a time, you do have a lot of flexibility with one of these type plans. And these plans may or may not include prescription drug coverage. Now, the plans that are offered through Education Minnesota on the group benefit side all automatically include a qualified prescription drug plan built into the rates, so automatically attached to these plans. Now the third and final type of plan that you could purchase would be a Medicare Advantage plans. These plans are actually your Type C or Medicare Part C plans. So how these plans work is you actually assign your right of Medicare to a private insurance company. Now don't let this scare you. You're not assigning your rights over forever. All you're doing is you're agreeing to run all of your bills through one private provider. When you do that, that private provider is actually being subsidized by Medicare to take your risk on for that year. So what happens is that you can put that Medicare card away in a safe. Because, as a reminder, that Medicare card is going to have your Social Security number on it. So you want to be very careful with that card. So you can put it away in a safe because you're agreeing to run everything through that private company. Now with that, you're also agreeing to stay within that private company's network. Now, I will mention that it's important to know that in the case of an emergency, you're always going to be covered the exact same under any of the different types of plans, whether it's a Medicare supplement, whether it's a Medicare cost, or whether it's a Medicare Advantage plan. You're going to have in-network services for emergencies. That's going to be covered the same. Outside of emergency, you want to make sure that you understand, does my carrier offer a network outside of my state, or do they not? What are my options when I'm working with a Medicare Advantage company if I do need to get care outside of an emergency outside the network? And each carrier can have little different benefits built in. Some carriers will cover you 80%, which means you pay 20%, and some carriers have even nationwide networks where you have the opportunity to get care in a different state because they have a network in the state. It's just one thing you definitely want to focus on if you're looking into a Medicare Advantage plan and fully understand what type of benefits do you need when you're traveling and how that would affect your plan. Now again, as I said, travel benefits may be limited. This really just depends on your travel needs and what you're looking for. And these plans usually include prescription drug coverage. And again, once again, all of the Education Minnesota sponsored plans are going to include the prescription drug coverage built into the plan itself. So now let's talk about prescription drugs. So we've talked about the medical types of options that are available in Minnesota. Now let's talk about the prescription drugs. Now there's a couple things to know about prescription drugs when you're on Medicare. The first thing to know is that Medicare sets the rules for the different drug providers. So the drug programs are offered through private companies, but Medicare sets the rules for those companies. Medicare requires that each provider that offers a prescription drug plan covers a certain amount of drugs in each of their 26 different disease categories. They require that each provider carries at least 2 medications in these certain categories. However, it's up to the carrier, the private company that offers the drug program, to choose which ones they would like to add to the plan, and that's known as the formulary. So you want to pay extra attention to the prescription drug formulary, because if a drug shows up on the formulary, that's good. That means your drug is going to be covered. If your medication does not show up on the formulary, that means you, as a member, are responsible for paying 100% of the cost of that drug for the entire year. Now, there are always exceptions. So if you're on a carrier's plan and your drug changed over the course of the year, or the carrier said it's no longer covered for the new year, there are ways to get exceptions by getting a doctor's letter and working with your carrier to get a formulary exception request, so they get added to the formulary. So it's not always it's either on or it's off, because there are always exceptions. So I would encourage you, if you have a drug that is no longer covered under a formulary, or you can't find under any carrier's formulary, to work with a provider to try to get an exception. That will save you money and that will help you. Also, if there's a drug that, usually if it has a generic equivalent, but the generic equivalent did not work for you, and now you have to take a brand name drug, there are ways that you can get a doctor's letter if you work with your provider to possibly lower the cost of that drug on their formulary as well. So I encourage you that if you're on high cost medications or having a problem with the formulary, to work with your provider and to try to go through the appeals process. So that's the important thing to know about Medicare prescription drug plans. But another important thing to know, which is different than what you've been used to, if this is your first time into Medicare, is there's something called the donut hole, otherwise known as the coverage gap. Now, the donut hole, or coverage gap, is basically a time when your medication insurance would turn off. Okay, so for a lot of people it can cost you quite a bit of money. So it's something we definitely want to be aware of. What it is it was basically put in place to help spread the costs for people that were on higher cost medications to have more of a cost share versus people that weren't on any medications. So this donut hole actually is based off of a couple different things, and I want to break it into different levels because I feel like it's the easiest way to understand that. But before we break into the levels, it's also important to know that this donut hole calculation runs from January 1st through December 31st. Every year this donut hole calculation will reset. So if you hit the donut hole one year, you may not hit the donut hole next year. It just depends on what drugs you are on and how much those drugs cost. So the donut hole breaks down into 3 different stages. Okay, and before I get into these stages, one more thing I'll mention is that the government's trying to close this donut hole gap by the year 2020. So what they've done is they've implemented discounts. So if you do find yourself in the donut hole, you will pay the majority cost of the drugs, but you will not pay the entire amount. And I'll go into that once we talk about the donut hole. So let's start with stage 1. So stage 1 of the donut hole is when you, as the insured, just pay your co-pays or deductible, if you have a deductible first, then your co-pays or co-insurance based on where your drugs fall on your carrier's formulary. So that's the insurance that you're buying, is you're paying the co-pays based on their formulary. Now you stay in stage 1 and continue just to pay your co-pays until the total cost of your drugs equals $3,310 in annual cost. So when I say total cost of drugs, in stage 1 you're paying co-pays. Let's say you're on a drug that costs you a $100 copay. Okay, so we know that $100 copay is not the total cost of the drug, because the insurance company is also picking up a portion of that drug. In our example, let's say the insurance company was picking up the cost of $400 for that drug. So when we're talking about total cost, we know that you're paying $100 and the insurance company is picking up $400. When I'm talking about total cost, what I mean by total cost is the $100 that I'm paying plus the insurance company's contribution of $400. So for our example, that total cost would be $500. Our insurance company is still getting a negotiated rate discount for that drug. So it's not actually the drug cost if I just went to the pharmacy without insurance, because we're still getting credit for that negotiated discount. So once again, if I'm paying $100 out of my own pocket, the insurance is covering $400, our total cost would be $500 for that drug. Now, in our example, roughly month 7, we would exceed $3,310 in total costs. So if our total cost of the drug is $500, again I'm paying $100, the insurance is paying $400, month 7 we would reach $3,500 in total costs. So in month 7, we would now enter into stage 2, which is called the donut hole, or otherwise known as the coverage gap. Now in stage 2, we used to be responsible for 100% of the cost of our drugs. However, as I mentioned earlier, the government's trying to close this donut hole gap, so they're giving us discounts towards the donut hole. So in that situation, we're actually getting a discounted rate towards the donut hole, which we'll go over in a minute. But what you can think of is that during stage 2, it's definitely going to cost you more out of pocket than what you were used to during stage 1. So this is the part where people can pay a lot more out of pocket. Now, it's important to know that through Education Minnesota, as an Education Minnesota member, there are 2 plans. One that's offered through Medicare, one that's offered through UCare, that actually fill in this stage 2 or this donut hole. So for members that are part of that donut hole, or fall into the donut hole, I highly recommend, or members that are worried about falling into the donut hole, I highly recommend you look at one of those options through either Medicare or through UCare, because they have plans that would allow you just to continue your copay all the way through stage 2. So we stay in stage 2, not forever. We stay in stage 2 until we pay out of our own pocket $4,850. Now this gets a little bit confusing because it's important to know, if you remember, that in stage 1 we stay in stage 1 until the total cost of our drugs. So that's what I pay plus what the insurance company pays, right, out of our own pocket. So a total of $500. That put us into stage 2. But in stage 2, we can't leave stage 2, and we don't get any credit whatsoever for what the insurance company has paid on our behalf. We only get credit for what we've paid out of our own pocket. So the important thing to note is that the difference between stage 1 and stage 2 is that in stage 1 they're looking at the total cost of the drugs. In stage 2 they're only looking at what you've paid. So if we, in our example where we pay $100 per month, the insurance pays $400, we enter into stage 2 roughly month 7. But in month 7 we haven't paid the full $3,500 ourselves. We've only paid 7 months of a $100 copay, so therefore we paid $700. So now in order to leave stage 2, we have to pay an additional $4,150. So that's where stage 2 can be extremely expensive for people. If we do reach that $4,150 in additional cost out of our pocket, then we leave the donut hole and we enter into stage 3. In stage 3, the insurance turns back on, and we would pay usually 5% of the remaining cost of our drugs. And stage 3 would continue through the rest of the year. Once again, starting January 1st, the entire calculation would reset. So that's how the donut hole works. Now, as a final reminder, if we do find ourselves in stage 2 of the donut hole, the government has implemented this discount program where if you are on a generic drug, you will pay 58% of the drug in 2016, and for the brand name drugs, you would pay 45% of the brand name drugs. So you are getting a discount. Now, the neat thing about the discount is that they're actually applying almost the entire cost of the discount towards your $4,850. So they're giving you credit as if you paid the entire amount. I say almost the entire amount because it's about a 2% difference they're not actually giving you credit for, because the carriers are responsible for 2%. So they're not giving you the full 100%, but they're giving you pretty close. So it's helping us get out of stage 2 quicker without having to pay more out of pocket. So that's the donut hole. So here's what I feel is one of the most important slides of the entire presentation. Now that we have a little bit of information about Part A, Part B, Part C, Part D, and what types of plans are available, what do we look for in a plan? How do we best compare these plans side by side? And the first thing I would recommend doing is taking a look at the formulary. As we just mentioned, it's very important you know how your prescription drugs are covered. If they're covered, if they're not covered, we want to make sure that we understand are the drugs that we need to take covered. We also want to look at our out-of-pocket costs. And out-of-pocket costs will be seen primarily in the medical side of things. So as we know in the prescription drug, there's no out-of-pocket costs maximum because there's the whole donut hole. But on the medical side, they do have an out-of-pocket cost maximum. And what that means is that even if you have co-pays or co-insurance requirements, in the worst case scenario, if you reach the out-of-pocket maximum, then you're done paying for the year. The insurance then covers you at 100%, as long as it's a Medicare covered service and as long as you're in the network. So that's truly your safety net on the medical side. So even if you have a really tough year of medical bills, that will be the most you'd pay out of pocket for anything medical related. We also want to focus on the network. We want to make sure that our doctors are in network. We also want to make sure that we can view a lot of specialists, and also hospitals and pharmacies fall within the network. Now I will tell you that any of these Education Minnesota sponsored group plans offered through Medica, Humana, and UCare are going to have very, very large networks. In fact, all of these plans even include access to the Rochester Mayo Clinic. Now that being said, I strongly encourage that you look and make sure that your pharmacies or your physicians do fall within the network. If you're seeing any kind of specialty person that's usually affiliated with only one carrier, you want to make sure that they still do fall within the network. Again, if you have any need for help with that, you can feel free to call me as well, and I'll provide my information at the end of this presentation. You do want to make sure that you're going to the doctors, or you can still see the doctors you want to see. Now, on the security, trust, brand equity, we've helped you determine what we feel the cream of the crop is in the industry. And so we feel very confident, we being Minnesota Health Insurance Network, my company, as well as Education Minnesota, in the reliability and dependability of these providers we provided. So that's the UCares, that's the Humana, and the Medica that we're offering here today. Then final, service and communication. Now here's where you want to focus on. I always tell my clients, you're going to get a lot of referrals from your friends, but you really want to focus on finding a plan that's best suited for you. Even if I have a husband and wife that I'm working with, a lot of times they may have different medication needs, which may drive them to completely different plans. Usually they have the same travel needs, so that may help on that side, but we may find people are just better off to have completely separate policies. So my point here is that if you get a recommendation or referral from your friend, and they tell you company ABC is the best one and you have to go with it because you're never going to find anything better, take that referral with a grain of salt. You truly need to find the plan that best fits your needs. They may be on a provider that's not covered in that, you may be on a provider that's not covered in their network that they're on. Or you may be on a medication that's not covered by their current plan. So you really need to buy the plan that best fits your needs. And remember, every year you can make a change. So you're not locked into this decision forever. You have plenty of flexibility to make changes. Now the last slide I have for you here is just a Medicare resource slide. So if you're new to Medicare, as I mentioned, the way to enroll into Medicare is through the Social Security Administration. So you can do that by going to the socialsecurity.gov website, or you can go into the local Social Security office and enroll into Medicare. Those of you that are already on Medicare that may just have Medicare questions in general, I encourage you to look at a site called medicare.gov. That, to me, is the Bible of Medicare. It will give you the most information available on Medicare up to date. Or you can always call the Center for Medicare and Medicaid Services. They're the people that kind of oversee Medicare, the rules and regulations as well. And here's some contact information for them. Again, my name is Tim Schatz. My phone number is at the bottom. It's 1-877-926-3366. Our office is located in Burnsville. So those of you that would like to come meet in person to discuss this, I would be happy to sit down with you, walk through your options, help you analyze whether your prescriptions are in-network, or in the formulary or not in the formulary, and walk you through the entire process from start to finish. Also, those of you that just may have questions about, working past age 65, am I covered, when do I start Medicare? Again, I would be happy to assist you with any of those related questions or any more with regards to Medicare. A great website for you guys to all go to is at the bottom. It's www.educationmn.mnhi.net. Now that's how you found us originally. So that's just a recap of the website for you, where you can access more videos like these, but on a carrier-specific basis. And you can also access the forms, the applications, the summary of benefits, and further detail on each and every carrier. One last thing I'll mention, if you haven't seen it yet, I highly encourage that you click on the 2016 All Plans Overview. That opens up a spreadsheet where I put side by side the key features of each of the plans offered through Education Minnesota, so that you can easily compare the costs, but also the care that you would receive, so the co-pays or co-insurance, and to help make your decision a little bit easier as to which one's best suited for you. And also on that spreadsheet you will notice that there are some active links, so it'll bring you right to the carrier's formulary. It'll also bring you to the carrier's physician directory, so feel free to utilize those links as well when determining which plan is best for you. I thank you for your time, and I encourage you to take a further look into the additional carriers' resources on the site. Again, if you have any additional questions, I would be absolutely happy to help you. We look forward to offering these plans for many years in the future. And remember, if it's a good fit for you today, take advantage. If it's not a good fit for you today, it might be next year. So we encourage you to check back as often as possible. And on behalf of Education Minnesota and Minnesota Health Insurance Network, we thank you for your time and have a great day.